Leaving marks with Graston and cupping, the picture-worthy soft tissue treatments. One thing to remember is we never take picture of the normal or the not quite exciting. It's only fun to take pictures of the wild, the crazy, or the oh my gosh. So many times patients will bring pictures into the office of something they saw online and look at it and go, oh my gosh, can you believe this? Yeah, because we see it. But sometimes there's more of a story with it. Sometimes it's too much, and sometimes that's just how the bodies react. Some people really react a lot. We use Graston for many things besides just causing bruising. It's therapeutic, both for the patient and for me. In this example, we're working the neck and upper back, have that rounded forward posture, those headache makers, and also that back of the shoulder. For that forward rounded posture and someone who's been very active, that dark red line is an example of soft tissue injuries through a lifetime of wear and tear. Like I said, nobody ever takes pictures of the normal, only of the crazy. And we never start this aggressive with patients. You work your way up to see what they can handle and what you can get away with without overwhelming it. So scars are an easy one. Scars have a lot of cheap and easy scar tissue that was slapped down to seal up that line. And over time, we can come back in, work the scar, and put more normal type tissue in it. We'll get rid of that dark white line. So this is an example on that right-hand side where you see the redness. Any place that was red is going to react. And that reaction is meanings we're going to change the tissue and it'll look a little bit more normal. This one's going to have a solid white line all the way through, but it won't look as bad. Likewise, you see other spots on that right picture where it's just still white, nothing changed. That's an example of that scar of that section is not going to improve at all. It is what it is. And of course, you know what bruises on the front of the neck look like. So if you ever see this or a patient, we start working the front of her neck, I always remind them that rule 1 in the office is always blame Mike. A lot of neck and mid-back problems, we're going to see this example, especially with the patients who have that chronic neck, upper back issue. They always want somebody to rub those red knot spots that we see there. They feel those knots that never go away. Well, those are spots that are going to react to Graston. A lot of times there's soft tissue injury in there that we're going to clean up. This is an example of someone whose skin's a little hypersensitive. Even with a little bit of scraping, we got a heck of a reaction. It looks really bad, but I hardly dug on her at all. And every time we'd work on it, we get this bright red explosion of color that would slowly calm down over an hour or two and get to a few little bruises, but nothing significant. She'd always feel better afterwards. She had improvement with her headaches. It was a good treatment for her. It just looked really bad for an hour. So what did I do? I made a floor mat, put it right in front of my treatment office with a big line on it, said, don't be late. It was great to see new patients walk up to the door, kind of look down, look back up at me, look back down the mat, look back up and say, I was 5 minutes early. Don't do that to me. It was amazing. The office ran on time really well when I had that mat there. We use Graston, Shockwave for a lot of soft tissue treatments. It's another way to attack the problem, especially for people who have chronic neck, upper back, shoulder pain. These are great treatments for it to break up those soft tissue adhesions. Now, this is after about the 5th or 6th visit. The person kept getting better with the treatments. We kept digging a little bit deeper and a little bit more surface area. It looks bad, but it was going to calm down here shortly and continue to get that relief from the treatment. This bruise, not me. People come in with some nasty looking bruises sometimes. Sometimes it's falls, sometimes it's other types of trauma, or the do-it-yourself Graston using a kitchen knife or a spoon that'll just tear up the epidermis. It creates some ugly bruises, but it's really not that therapeutic because you can't get deep enough. This is an example of a hamstring tear. We get that pooling of blood at the bottom where that drainage stops, that nice clean line you see at the bottom, and it's going to take some days to weeks to clean up and get less noticeable, but not a Graston scraping scar. This wasn't me either, but it was a forearm sprain where the person tore a lot of that muscle tendon, that fascia inside, had this big bruising and swelling, and we helped decrease that swelling and definite redness with the laser and the compression on the arm to help push that fluid back and out. This one was me. Sometimes we use cups to get these same reactions. Cupping, you're using that suction force to pull the tissue away, which will break up some of the little blood vessels, giving these dark red or petechiae. We see some white spots, we see some red, some areas are more reactive than others. This is a good example of someone who's got that neck and upper back issue that we went to cups with, where there's some spots where I just put the cups on a little harder and then dug with Graston afterwards, or moved the cups. That shows another way to tear up more of the tissue underneath. So stationary cups versus the moving cups, you see how that dark redness on that right-hand side is just more aggressive versus the singular placement. So if we want to get meaner, this is another way to attack the problem. This was a chronic sloucher. His skin was reactive, but he had just years of being that forward flexion. He would react pretty significant to Graston too. He just felt better after the cups, and especially when he got a little bit more aggressive with them. This was not the first time I had the cups. We worked our way up to this, but he felt relief every time we did it. This is my dad. He was annoying me one day, so I put a smiley face on his back and didn't tell him. He found out there was a smiley face when he was at the community pool and somebody asked him about it, and he was mildly embarrassed, to say the least. This is Shockwave. We attacked it with Shockwave. Same thing. We see that neck, upper back, shoulder zone that really responded to the treatment. We have those white zones of the histamine response with some of the redness. So for me, we started with the Shockwave, and then we're going to work towards the Graston. I couldn't wait to get in there with the Graston tools and see what we're going to find. This is an example in the low back where we had that big explosion of white. It's almost like a bee sting, that histamine response on the paralumbar spine, so just right next to the spine. And you can imagine this is somebody with chronic low back pain who always had that ache and muscle tightness and guarding in this zone. Here we're using the cups and a little bit of sliding cups once again. Nice ugly mark. We see some of that bee sting, that histamine response with it too. Now this, coming back down to reality, is more of a normal, hey, we get some dark red spots, we get a little bit of white, we see a reaction of the zone. It's probably not even going to bruise, maybe a wee little spot, but in a few hours, you're not going to notice much of anything. Definitely not picture worthy, but this is the most common, and this is what we see most of in the office, not the stuff you're going to see on Instagram. So we can learn more on soft tissue treatments at our Graston Technique page, where we have shockwave laser cupping, all the other treatments with it. Anything to break up pain and soft tissue adhesions can help increase our range of motion and flexibility and add to our therapeutic benefit. So have a great day, and thanks for listening.